we've got to travel.
I'm going to come to a couple of local issues in a moment. Just before we do that, can I ask you a couple of questions on national issues again, or can be the cystic fibrosis drug? Where is the HSC on agreement on that?
Well, there's talks going on probably as we speak. There's certainly talks due to take place today. There were talks that took place yesterday in relation to this. If we go ahead and purchase this drug, it would probably be the most expensive drug we have ever purchased in the history of the state. But there's lots of families out there with people with cystic fibrosis and lots of cystic fibrosis patients who really want this drug, and I understand that. They've waited an awful long time. As Minister and as a HSE, I suppose, we have to make sure that we don't allow a drug company extort the taxpayer. We have to make sure that we get a deal that works not just for the taxpayer but for patients. That means we won't be back at the negotiating table in a year or two if a new version of the drug comes out and have to start the whole process again. So I am hopeful of a deal, but I don't want to say anything that will in any way undermine the people negotiating on behalf of the state today. I do want to bring this process to a conclusion. I said I wanted the process concluded within weeks. That remains my position. I want this process concluded ASAP, but I've got to get the right deal, and that requires the drug company and the HSE working together as they are today.
This drop in vaccine uptake, I'm thinking specifically of the HPV vaccine. Yeah. Are you concerned about that?
Extraordinarily.
A lot of chatter on social media, a lot of campaigns against the drug, and there has been a corresponding drop in uptake. What are you going to do about that?
I'm extraordinarily concerned. I mean, we actually have in this country a cure for a certain type of cancer. We actually have a vaccine that if we vaccinate our young girls in school, we can prevent them getting cervical cancer. Every year, women in this country, number 100 women in this country die of cervical cancer, and that is entirely preventable with this vaccine. We need to see people vaccinated, and what has happened is, and it's really quite disgusting actually, there's been scaremongering and false information about a vaccine that has been approved by the World Health Organization, it's been approved by the European Medicines Agency, has been so rigorously tested. I'm not a clinician, but it has been so rigorously tested by clinicians. And actually I spoke at a cancer conference yesterday, and I thanked clinicians and I thanked the Irish Cancer Society for doing what they're now doing, which is going out and actually debunking the myths, actually saying to people, well, I'm a doctor and this vaccine is safe and this is why you've got to do it, because if you don't do it, women can get cancer. So we need the clinical community, and I know they're well up for this, to be even more robust. And you're right, the space in which we have public debates is changing. A lot more happens on social media now, and we need the clinical voice out there as well. So my message to any person in Wicklow listening to this, if you have an option of vaccinating your child, please do. This vaccine can literally save their life.
Should we be giving it to boys as well as girls?
My gut is yes. It's to go through a health technology assessment, so we have a process that has to go through for that. That will take place this year, and if that stacks up, I would like to see universality, because I think universality does help increase uptake as well.
Can I ask you just about some local issues, Minister? Concerns about Sunbeam House Services in Wicklow. What's your position on that?
Well, Sunbeam House Service has provided incredible services for many years in Wicklow, but I think in recent months and indeed years we've seen a number of parents express very serious concerns, and I believe those parents. I've met those parents. I know many of those parents. Some of the concerns are extraordinarily serious. I want to work with the parents to make sure that they get answers, and I want to work with the parents to make sure that their children get the service they deserve. The HSE recently appointed Gordon Jays. Gordon Jays is from Scotland, used to head up the Child and Family Agency here, to carry out an external review in relation to a number of matters in Sunbeam. That report has now concluded. It's with the HSE. The families have seen it, and I expect that the HSE will now ensure that action is taken. I want to see every single recommendation in that report acted upon with great urgency, and I intend to meet the HSE on this in the next week, and I also intend to meet families impacted next week as well.
It's an issue that's been covered here on the show.
Yeah,
HSE report was published online 3 weeks ago and was taken down. Why was that?
I think it was unfortunate. My understanding is there's a process that's meant to be followed before you publish the report. They were meant to maybe have redacted some confidential information. I'm not 100% certain, but some confidential information in relation to people's names and identities, which would be normal in relation to reports. The good news is that the family's got it. The good news is I have it, and we've all read it. And I think the families, myself, the HSE, and indeed the Board of Sunbeam are in no doubt as to what the recommendations are. And some of the recommendations are very serious and need to be followed. I need to be very careful what I say in the position that I'm in, so that I don't prejudice any process that needs to take place. But I expect the HSE to get on with making sure that all the recommendations are implemented, and I'll be meeting the families next week to discuss that.
Another issue of local concern is mental health, of course, and suicide prevention. What steps are being taken here locally around these issues?
Yeah, I mean, look, we have seen suicide really blight the community here in Wicklow, but also the country over the last number of years. My colleague, Minister Helen McEntee, has put in place a youth mental health task force, which is instead of young people being told by the HSE or told by government, here's what you need to do. It's about empowering the voice of young people, working with companies like Facebook and Twitter. And she's been having some really interesting meetings. And that task force is due to present a kind of action plan of actions for young people on mental health in the next couple of months. But I launched only last week, actually, the Wicklow plan for suicide prevention. This is the first local plan. And so we have national policies in relation to suicide prevention, but it's so important that we have action on the ground. So I had the pleasure of launching our Connecting for Life strategy for East Wicklow and Dublin South and Dún Laoghaire. And what this is basically about is saying, yes, the health service definitely has a role to play. Of course it does. But so does everybody. So do guards, so do teachers, so do young people themselves, so do all of us as citizens. And it puts together a structure that will bring together all of those people to talk about in our own county, in our own area, how are things going, what needs to be done, how can we make our population more resilient. And like I say, we are the first area to have this roadmap, so I'm looking forward now to it being implemented. We have seen suicide rates decrease in this area, which is encouraging, but we have so much to do, and every death lost to suicide is obviously one too many.